Okay, good morning, folks, and thanks for joining this morning for our WebEx on lowering the cost of employee benefits and workers' compensation in an uncertain market. There's never been a more uncertain market in my professional life in 30 years than I'm seeing right now. So it's going to be an interesting conversation. Let's get a little bit of the logistics out of the way, just so we can set the ground rules for this event today. So participant mics will be muted for the duration of the presentation. We encourage you to ask questions using the Q&A box. The button's found at the bottom of your screen, and you can ask questions at any time. We'll address them at the end of the presentation. Information today is provided today, is intended to be general and educational in nature and not considered legal advice of any kind. The webinar will be recorded, and we will be sending it out to all of the registrants shortly thereafter. I want to introduce myself. My name is Christopher Lebrecq. I am the president of Employee Benefits Group here at IOA with the Insurance Company of America. The purpose of today's program is really about talking about integrated care and what it means to have the right partnerships when you engage for workers' compensation and employee benefits, basically treating the entire patient. Clearly now in the industry, what we're seeing is tremendous silos. Makes it very difficult to understand your own data, to understand what's happening, to navigate a patient through the care continuum, and obviously reducing costs while you're doing all of that and improving medical outcomes and the member experience. The future employer-employee expectation is, and we're seeing this with the COVID, is really a changing social construct. Employees need more, want more. They want personal, relevant solutions. They want guidance. They want advocacy. And employers want to deliver that to them because ultimately that reduces cost overall. The current state of affairs makes it very difficult to do that. Not talking about COVID particularly, but more just the state of affairs. If you think about the average HR director, they have to manage so many different relationships on behalf of that employer, a workers' compensation provider, as well as a broker, a benefits provider, as well as a broker, possibly a relationship with a healthcare system, and all of these other points of touch points that they have to manage. It makes it very difficult, and most of them are siloed. They're not sharing information together. So we're excited to talk today about a partnership that IOA has with Orlando Health and now Jewett Orthopedic, which is fantastic. And we have two folks here with us on that conversation. The first, and I'm going to introduce him and have him introduce himself as well, is Michael Stubbe. Michael is the Assistant Vice President of Managed Care and Revenue Management for Orlando Health. Michael and I have known each other for quite some time, and we've worked together with his team. Michael, say hello to the group for a moment.
Hey, good morning, everyone.
You're muted, buddy.
You guys giving us the opportunity.
Michael, can you take just a moment, just 2 minutes real quick to give us the state of the state at Orlando Health? Obviously, there's a lot of things going on in the industry specifically, but nationally, there's some tremendous movement right now. Just give us an idea of what's happening at Orlando Health from the state of the state.
Yeah, well, 2 minutes is, I'm going to see how much I can compress into that. No, obviously, any healthcare system right now is dealing with the effects of COVID. And, we've been through some ups and downs in terms of what that has meant to, the strain on our system. We've certainly seen some heavy peaks and some pretty, flat valleys. And so right now we're kind of on a downward swing in terms of dealing with COVID, just watching what will happen through the rest of this year. Aside from obviously the pandemic, we're still trying to maintain operations as normal and really kind of continue to deliver the value and the quality that we've been doing, ever since, certainly over the 100 years of Orlando Health's history, but certainly over the last few years, we've done a lot of exciting things. And so our vision is to keep on the same path. We're growing and we're adding some additional capabilities. And then we're also going to have a system conversion next year that we're pretty excited about. We'll get a chance to speak a little more about that. But, it's a challenging environment for any healthcare organization. We seem to be weathering the storm about as well as anybody can. And so look forward to, what the future brings for us, because we're still pretty optimistic that we can thrive despite the challenges of the current environment.
Understood. I know I only gave you 2 minutes. I appreciate you staying to that, but we got 54 minutes after that to unpack a lot of that stuff. So I'm sure we're going to have some conversation around that. The second speaker we have is Karen Erslich of Jewett Orthopedics. She serves as the Director of Professional Client Relations and Workers' Compensation. Karen, take a moment just to introduce yourself to the group and also give us a state of the state of what's happening at Jewett.
Good morning, everybody. My name is Karen Erslich. I've been with Jewett about 6 years. Prior to that, another group, orthopedic group, and what we are going through right now with COVID is different as everybody's going through it. But we continue to have to treat our injured workers and our patients. And so we have not slowed down at all. I know with everybody working from home or not even, some folks are not even working anymore, we continue to see a steady number of patients that still need to be treated. So we are doing our best to accommodate obviously following the guidelines and what's going on with the pandemic, just to take care of those employees, to make sure they're back to work healthy in the best manner that we can. We offer a number of ways to try to accommodate. As far as offices, we have walk-in clinics that are just for orthopedics for the urgent matters. But other than that, we are doing the best we can. My team is working very hard to try to make sure that all the calls and concerns and requests are handled properly and timely. And we're just very excited right now to be merging with Orlando Health and getting that support and that great network. And I'm probably under 2 minutes, right?
Yeah, no, well done, Karen. Thank you. I appreciate that. Yeah, like I said, we'll unpack a lot of this in conversation over the next 45 to 50 minutes. And I'm sure we're going to have some questions from the group as well, because they'll pop those into the Q&A as we go, and we'll try to answer them at the end. IOA from a state of the state, very interesting, right? So March 13th, we went to work from home, and within 10 days, we had just shy of 1,400 employees all working from home with virtually no drop off in productivity, which was extraordinarily interesting, considering if you do the math, our operations folks did the math, we gifted back about 220,000 man hours of commute time. And they didn't let us down. Our staff, our team actually increased their productivity, but got a ton of time back to their families. So the dynamic that we are facing, we're not going to look like we did in January, but we're never going to look like we did in January, but we're not going to look like we do now. It's just going to be very interesting to see how that unfolds, and ultimately how we continue to serve our clients. And I'm sure the two of you feel exactly the same. So, we had this recent merger between your two organizations, which was sort of tectonic in the industry, honestly, because it is starting to marry different areas of care in a more seamless approach that really makes a difference at that end user level, at that employee and user patient level. And that's something that I think we really need to talk about. That's really what should be featured today in this discussion as we talk about it. It's that patient advocacy that's surrounding that patient through the continuum of care with a seamless, siloless effort that really delivers something that's impactful. Michael, take a moment just to talk about the merger between Orlando and Jewett, what the intent was, and have you seen any surprises, or what are some of the things that you're seeing coming out of that, and what are the things you want to happen in the future?
Yeah, thanks. So, it's something that I've been looking forward to for quite a while. These discussions don't take place, quickly, and nobody considers these decisions lightly. At the end of the day, we were talking about a very large, well-established, historical physician group in Central Florida who was kind of giving up their own independence. And that's an existential question for a lot of physicians. And that was before COVID. Certainly the pandemic has created a whole different dynamic for physician practices to consider because, a lot of physician practices have lost volume as either people have lost insurance coverage or they've been reluctant to seek care. So, certainly having a safe harbor of being part of a larger health system, I think, was an unforeseen benefit to the larger Jewett group. But I think really, at the end of the day, we were talking both about creating the perfect patient experience for musculoskeletal care, right? And if the hospital was looking at it from a perspective of who is the right partner to bring into that model, then obviously Jewett was a huge piece of that consideration. And then I think if Jewett's looking at it from their perspective, they've done so much on their own with their own ambulatory surgery center and their own physical therapy, and sort of lacking that full continuum, the acute care footprint, and some of the other modalities that can be brought to the table when a hospital and a physician group like this get together. So I think what we've done is kind of married the best of both worlds from a physician orthopedic group standpoint and a community-based hospital system. And the vision is really to create a center of excellence that will become a destination for the entire southeastern U.S. I mean, it doesn't get any bigger in thinking that way than the way they've constructed it. There's been some information out in the news and elsewhere where we're obviously going to be building a physical building on our downtown campus that will house this center of excellence. And while, there's a perception that when health systems build buildings, that's a cost that everybody has to bear, and I'm not disputing that, the cost of healthcare gets really disproportionately spread around to the commercial base. I think what we're talking about doing is creating a continuum of care for musculoskeletal services that will enable us to steer people to the right place of care at the right time. And I think there's long-term cost improvement factors that can be built into this delivery model. We'll talk a little bit about what Orlando Health has done around cost containment just very broadly in some of our other relationships, but this fits in perfectly to that vision. So, if we have somebody that needs some type of orthopedic surgical care and it can be done in an ASC environment, we are going to steer patients to that site of care. And it's already happening with things like total hips and total knees. And so this only enables Orlando Health and Jewett together to do even more of that. Certainly the federal government through Medicare is supporting that. The private payers are starting to support that. And we as a clinical system will be able to support it just as much. So we think of it as a higher state of being with even more value that will come back to the purchasers of healthcare.
Yeah, and that's important, right? So we talk about advocacy. Advocacy is nice, it's wonderful, but if it costs more to have advocacy, then that becomes a challenge. But that's actually not the case, right? So when you start to look at this, and from IOA's perspective, we have two sides of our house, and I kind of curse people who say sides because I believe we have two areas that are trying to work together, not sides. Our property and casualty team, specifically speaking, for today's purposes, around workers' compensation, and our employee benefits team, for today's purposes, talking about general health. And so the challenge when you don't have a seamless provider network to deliver those two things and share data is that we're forced to try to pull those silos together and try to almost manuscript or coddle it to a process together that actually supports. It's been very difficult. Now we're starting to see with healthcare really changing. And I think COVID has done two things. It's revealed a lot of weaknesses and it's accelerated a lot of plans for people. And I think we're seeing that here. It's starting to change the conversation for IOA, particularly for our clients around, what's the total patient care picture look like? So, and when you do that well, back to advocacy, you're really controlling costs tremendously. Karen, strategically, Jewett's relationship with Orlando Health, I'm sure they looked at this, talked about it, as Michael said, none of these decisions are made lightly. What was the thought process of engaging with Orlando Health versus maybe one of the others? And more candidly, what does that do to increase your value proposition as you interface with employers in workers' comp specifically?
Well, for us, it was quite exciting, and there was actually no other better partner than Orlando Health to be in this great adventure and that we're heading into. For me, particular, was extremely exciting from a work comp standpoint because of the access and the comprehensive list of specialty that we're going to be hopefully have available for the work comp industry. We also want to be able to provide all the services, and the continuity of care is extremely important for us, and also providing the best care available, which is what we have with our Jewett physicians and Orlando Health, is two of the best. And for us to combine is going to be a great advantage for the work comp industry, for the injured workers to be able to have access to such a great network with so many specialties. So what we have in the works coming up in the future is super exciting for us. And for me particularly, and I know that's the sentiment for everybody at Jewett, we were super excited. And we cannot wait to get to all the things that we have to offer and work those things out.
Yeah, That's great, and I think that's part of the discussion is really around how do you leverage each other's value proposition really well on behalf of the patient and by extension the commercial payer or the employer for sure. Michael, take a moment to talk about the implications of interdisciplinary care. So you know this. Your team's been very supportive of me, particularly my family. My wife went through a breast cancer diagnosis and went through the Orlando Health system in that, and she was blessed with having an advocate support her through that interdisciplinary care, which did a couple different things. One, it just coordinated things much more effectively and reduced costs by virtue of non-duplication. But most importantly, it made the patient feel very comfortable that they had a complete team around them to support that. So Orlando Health is very well positioned from birth to disease management and everything in between to serve the community. But talk about interdisciplinary care and what the implications are from a cost standpoint.
I think there's obviously two sides to that interdisciplinary model. The one that you spoke about personally with your family, that's a very high touch, patient facing, comforting model that enables people to deal with, really a horrible situation, right? I mean, there's some of the worst moments in your life are in that moment. And if you've got somebody there who's guiding you through the process, then it makes it more bearable. And I think that it's inherent in the nature of how we would render a interdisciplinary cancer care model, because you sort of have those difficult moments along the way. The same is true in orthopedics, where, an injured worker or somebody with musculoskeletal problem is going to have a variety of challenges, from the diagnosis to the treatment to the recovery. And all of that, there's various touch points. And if it's disconnected, it doesn't feel like a process of care that somebody's watching you along the way. So when we build our center of excellence, it is absolutely going to be with the patient at the forefront. And that will, there will be navigators that will help people move through that continuum. And the other thing that happens with this navigator model, and it's true in cancer care, and it will be true in orthopedics, and it's true in cardiology too, if you really want to think about other models that we've built, and that is our navigators help people get to the lowest cost point of care. There's the culture is highly focused around not only that perfect patient experience, but also the financial ramifications of what we're doing. And so the idea being that when you've got a coordinator, when you've got a navigator out there, you're eliminating unnecessary tests and treatments, right? So for example, in a musculoskeletal sense, you wouldn't want somebody to get multiple MRIs who didn't need one, because that's unnecessary cost in the system. You might also find that somebody is of not such a high acuity that you could do their surgery in an ASC, or at least in a hospital-based outpatient environment, as opposed to admitting them as an inpatient and getting a full DRG payment out of the care. And for us, yeah, the revenue implications are different at those different touch points. But if we're managing total cost of care, if we're embracing that patient from birth to end of life, then the revenue sort of takes care of itself over time. And it's not about any episode, right? It's about that longitudinal cost of care and the relationships that we build. And if we don't generate efficiency and cost savings along the way, those relationships erode, right? So we've got physicians in the community who refer to us because they know that we're good stewards of the dollars that actually they are accountable for. We've also got payers that send us patients because they know we can do things more efficiently. And so as we really engage directly with employers, who in many cases are the true payers, and the Cignas and the Uniteds and the Aetnas and everybody else are really just processors, that's where our message needs to resonate back to employers, because we want to be good stewards of their money too. And all the while, obviously, still delivering that seamless patient experience that wraps our arms around people and takes care of them.
So I guess there's two sides to this, and I just want to take this one step farther, just so I clearly understand it. There's per unit cost of care, right? And the irony in this world is that per unit cost of care for best medical outcome is typically lower than per unit cost of care not for best medical outcome, right? So it's not, purchasing a car where you get a luxury vehicle for $100,000 and a mid-range vehicle for 50. It's the other way around to a degree, right? So, but the bigger picture, Michael, that I think I'm learning from you is the utilization factor, right? So it's when you smooth out that utilization factor over a longer period of time, that total cost of care, that's the bigger picture. That's the bigger dollar that we really need to be looking at, rather than just let's squeeze the per unit cost of care. Is that accurate to say that?
Oh, it's 100% accurate. I mean, a lot of attention is put in healthcare around the actual price. And look, we do ourselves no favors. The industry is really horrible at this, right? And there's activities ongoing around price transparency, and we absolutely support that. And we're going to get there as an industry. It's a hard process to get there because of the legacies and the history that we've built, but I think it's the right thing to do. But at the end of the day, if all we're focused on is unit price, then we're not looking at what's actually driving cost of care. And so the example that I would give you to relate it back to something in cancer is this. Actually, our cancer services are a little bit of a higher unit price because it's a hospital-based mechanism. You can actually go out there and get chemotherapy or radiation therapy cheaper in a freestanding imaging center environment or a freestanding radiation therapy environment. But the difference is that you might get more units of service in those environments because of their care delivery models. We've actually done some things in our cancer center to reduce the cost of care that are pretty amazing. We've done such things as what we call hypofractionation, and not to get too lingo driven, but we do fewer numbers of treatments, higher intensity service with the same result. And that actually, it actually erodes our revenue model, but we think that if more patients, more purchasers saw that dynamic, we would get more patients. And so our revenue actually improves when we see more patients at a lower reimbursement per patient. Another example is we've actually started shifting to some oral chemotherapy modalities as opposed to infusion. We don't get any of the revenue from the oral chemotherapy, but if we can get the same results and it's a lower cost to the purchaser, then in theory, we're buying referral loyalty because we're being stewards of that money. And then the third thing I'll tell you is something as simple as chemo being administered in our infusion suite. Some patients have adverse reactions. And one of the things we've done is employed a nurse practitioner who monitors patients in the infusion suite. And when a patient has an adverse reaction, a freestanding center who doesn't have that type of resource will call 911, put the patient in an ambulance. They're going to end up in an ED, and most likely they're going to get admitted to a hospital bed. We treat the patient in the chair and address the symptoms in the moment and actually avoid that additional cost building into the total cost of care. And so those are things that we would do, A, because it's better for patient care, and B, because we know that there's price sensitivity around our unit price. And so we drive a lot more value through the utilization side. And our aggregate total spend in cost of care for cancer, it runs circles around the market because we're able to build in those efficiencies.
Yeah, so we've seen data analytics with other employers where we look at the per unit cost might be low, but when you look at the utilization, then that just gets driven up, and the dollars going out are almost 2 or 3 times what you thought you were getting out of the per unit cost, because you had a fragmented system that wasn't working as a collective unit. So, Karen, let's dig in a little bit to that. You've been involved with workers' compensation. You're the director of client relationships for Jewett. What carriers do you work with from a comp standpoint? Who do you interface with most for Jewett?
Well, we usually actually work with all of them. We have very good connections or relations with all the local ones, which are you got CCMSI, you got Sedgwick, you got John Easterns. I mean, the entire list of carriers in the area and outside the area. We also have new carriers coming into Florida and starting the book business for work comp. And I'm actually trying to make sure that we start that relationship and building and cultivating that relationship for future relations with them once they expand here in Florida. So those are some of the top ones that we deal with, like Summit, we have a very good relationship with them. Heritage Summit, we work very closely with them, and they understand us from a provider standpoint. We understand them and what they need as far as making sure that claim remains within the reserves and that patient gets the care that they need. So as an employer, when we were by ourselves before, self-insure, we understood and how that was spent on the care of a patient. And so now we get to put that into practice, and we have been, just to make sure that the patient gets the best care, not necessarily, drive the claim reserve out the window, but we definitely want to contain it, but providing what is necessary and the best for the patient for the better outcome. So most of our carriers understand and have that knowledge from us, and that's why they trust us with the care of their injured workers.
So how's the conversation changed now with those carriers through your relationship with Orlando Health? They're already looking at Jewett as a center of excellence with respect to the results that you get, return to work and otherwise. Has there been any conversation around the broader relationship with Orlando Health and the impact that can have to control cost at the workers' comp carrier level?
Well, yes, it's definitely going to be containing a lot of that cost, especially when it comes to referring to other specialties. I noticed from experience then when you have a patient that needs a cardiac clearance, or they have other issues when it's a catastrophic injury, they need a multitude of providers that can simultaneously take care of that patient. And so what I know from hearing the adjusters and their concern is the lack of those specialties, and having that within our system, our network now, it is extremely amazing. From my personal standpoint, I get a little excited about this because I know adjusters just spend hours and hours trying to find a doctor, and sometimes they have to go outside the statutory 50-mile radius to get a provider that would even take that patient, let alone accept a work on fee schedule or agree on a reasonable fee schedule with them. So that is a problem they encounter on a day-to-day. I like to say this example that I had one adjuster that I'm very close with, that she had a patient that needed surgery. However, she had just recently had a kidney transplant. It took 2 months to find a nephrologist that would even take a look at the case and give her a clearance. So that is delaying care, that is adding cost to that claim. That patient cannot get better, cannot get back to work. We just have to keep everything moving. So understanding from all aspects what's needed for the patient, for the carrier, and the employer helps get the system and just a smooth transition through everything in the continuity of care. So having the providers available to the employer and the injured worker is crucial to minimize that downtime and just get the patient what they need when they need it, and just get them better and back to work safely.
So that's that perfect segue, Karen. Thank you. The way you framed that answer kind of led me into my next question. So when we talk about member experience, one of the things that we're trying to avoid in workers' compensation is what seems like 98% of the billboards alongside I-4, which is, I got a work comp injury and I sued my employer, or I sued this company, or I sued that company. Talk about the member experience, and when that's more positive, what that does to reduce those types of lawsuits. We're hearing from some, Heritage Summit et al., that's a massive lift from a cost standpoint on the back end. So tell me a little bit about that.
So I've had some personal experience with that, and it's just, it's very important because the patient, they need to feel like they're being heard. Often when they have a work comp injury, and I can say this from experience, you feel like nobody's listening to you. They're just going to do what's best for their pocket and not for your well-being. So right off the bat, they come with a negative energy, and their experience is, right off the bat, it's going to be negative. So we need to make sure that we are proactive and change that. So I have personally been involved to the point where we had patients where they couldn't speak English and they're at the hospital and they need trauma surgery and nobody's listening. They couldn't get a hold of the work comp adjuster. Nobody understands them. I personally drove to the hospital, help the patient, translated, the employer was inside, and I was able to help that patient and communicate with the adjuster what needed to be done to expedite the care and the surgery on that patient. I have gotten involved in situations where the patient is angry and they're just wanting a surgery and they're not understanding what that's not getting approved. Is if I'm around the office, I try to get involved right away and just explain to them the process. If you explain it to them, I think that just kind of diffuses that that hostility that they just right off the bat want to have. And of course, the billboards of, call the attorney when you're not happy. We're trying to prevent that and make sure that they're happy, that they feel like they're heard and cared for, and hopefully prevent them from picking up the phone and making that unnecessary call to an attorney. So keeping the cost down, communication is the key throughout the entire process. Communication with the employer, with the patient, with sometimes the family members. We have family members that get very involved in that loved one care, whether it's a trauma case or a regular spine case that they're hurting. We just want to make sure everybody feels like they're heard and cared for, and make sure that we can accommodate what they need in a timely manner. And usually that helps a lot. It goes a long way. Once that patient comes out of the work claim or that experience, they have a good experience with us. And they tend to come back on their personal insurance because they liked how we treated them and how we took care of them and listened to their needs.
So timing means a lot, right? So once you've gotten connection to that patient, you need to move them through that continuum so that they don't become, I don't want to say distracted, but disillusioned or upset that they're not being taken care of, like you said, not heard, and being ignored. The value of having synergy between you and your partners to help with that, right? Stakeholders that actually are focused on getting that done, i.e. Orlando Health and Jewett working together in combination with, let's say, an IOA and a summit, that allows all four pillars to really support that patient tremendously. And that does reduce care from a lawsuit standpoint, which is really good to hear. And something that we kind of thought about, but look at the current system in many ways, right? You have all these disparate entities that aren't working together, and the patient is bouncing from one place to another rather than being navigated, advocated for, cared for in a way that actually reduce costs. So it's exciting to have partnerships like this, but you can't have them when you don't have good stakeholders who are all kind of driving towards the same thing. And I think we've all heard Michael say this more than one time. Yes, what we're doing reduced our overall revenue, but it's the right thing to do. And ultimately, we think is going to serve the community better, which will provide the mousetrap that allows us to be sustainable. So I think that's really important. One other thing I wanted to ask you, Karen, tell me about how you interface with employers directly. I've talked to Danny Anderson, and you and I have spoken a couple of times with respect to how Jewett supports an employer directly. What does that look like in your relationships?
For me, it's extremely important. Whether it's communication with the employer, with the carrier, with the attorney representing the carrier, everybody is important in that plan and the care of that patient. For me, the main thing and the most important thing is communication. Communication between us and the employer, understanding what their needs are, understanding their workforce and what they go through as far as the job duties, helps us as physicians know exactly what the mechanism of injuries and possible things that we need to help the patient and help the employer prevent, to be proactive and try to minimize those claims. So usually what I try to do is meet with the employers, listen to their needs and what they are needing to accomplish, their preferences, and if they have any questions, to make sure that communication is smooth right off the beginning. And from there, we can make sure that we carry on that through the entire process. Any communication, we have to make sure we have open communication. We try to educate the employer and sometimes do a lot of lunch and learns or lectures for the employers and their employees to understand how to prevent injuries and things like that. Again, going back to preventing that litigation process to get started, it all is very important in reverse around communication.
So you're mapping up. Yeah.
Communication, yes.
Loud and clear.
Loud and clear. Yep. And usually that is the problem with the patient that doesn't feel like they're being communicated. So from the provider, we have to communicate with the employer. We have to listen to their needs. We have to communicate like duty or restrictions, making sure that is done in a timely manner, but also to the employee that feels like they're in limbo because there's a waiting period between authorization or they don't know what's going on. We have to make sure, I think it's our duty as providers to communicate and give them a status so they understand that we have not forgotten this is the process and we're just going to get to you as soon as we can and get you scheduled. And that usually helps a lot. So it's very important to have a very close relationship with the employer and understanding their needs and they trusting us with the care of their patient.
And if I heard you correctly, Karen, some of the conversation was around the education you do pre-injury, right? So you're helping them map what that path looks like, where to go, who to talk to, when to talk to them, so they know what that pattern of care needs to look like. The more the employer knows, the more they can also support the employee from the backside. Is that correct? You spend a lot of time mapping that out for them?
Yes, that is correct. It just helps work out the workflow for the employer so they understand the first steps to do when they have an injury and how to go about it, who to direct care of that patient, depending on the injury and the situation, of course. But that helps them expedite the care. So it's just, again, a continuity of care, and delaying care is not something that we want to do. So we want to make sure the patient gets what they need as soon as they need it. And the sooner the better, just to minimize that delay and possibly delaying the process on or the outcome on that patient. So we want to make sure we map it all out so they have exactly where to go, who to call, in the locations, and we just give them all the resources to make sure that they take care of their injured employee. Some of the other things that we're doing, since we seem to have lost Chris, is along with Orlando Health, we want to build this great network of providers, including not only physicians, but everybody across. Everybody is a key player in the care of this patient, whether it's imaging, whether it's physical therapy, occupational therapy. We want to make sure that the process is seamless for that patient. So we are working really hard and diligently to make sure that we get all those specialties ready and willing to help. And the communication that we're going to have within our system is going to be great with a new system. Mike, you want to talk about the new system that's going to be coming?
Yeah, no, that's a great comment. So, one of the things that I'll back up a sec, but, one of the things that's gotten me so excited as I've gotten to know Karen and as we've been talking over the last several months is, she really has a vision for workers' comp that I have shared and I've experienced in other stops in my career. And frankly, had found when I came to Orlando Health about 4 years ago that there was not a whole lot of inclination to do a lot around workers' comp, So we are really both aligned in our vision of trying to create a complete continuum of care, including specialties like cardiology, including our imaging centers, including our ASCs. And that's the benefit of having that wholly integrated delivery system. The other thing that we've done is we've built out an infrastructure of ambulatory sites of care. So pavilions with physician office specialty offices out in the community as opposed to downtown Orlando. So we can take this integrated care model further out into the community and make it more convenient, and that's a better patient experience. Chris, it looks like we might be getting you back on. No, we've lost him again.
No, but, Michael, I'm here. I'm actually on the call.
Oh, you're here.
Can you hear me?
Okay, gotcha. Yeah, we can hear you.
Yeah, the system,
we were talking
the system
about...
automatically called me. I appreciate you guys covering. Thank you.
Yeah, we were talking about just the overall system of care and how, coming together, and Karen's vision for work comp and what I've wanted to do is really a really nice blend. And so over time, I think we're going to make greater and greater improvements in the delivery model. And then she was kind of pivoting us to a conversation around our electronic health record. So Chris, I don't know if you want us to talk about that or if you want to cover any other topics.
No, you guys, you didn't need me to hit my own segues, and I really appreciate that because that's actually what I want to talk. I know you're going to a new system, and the ability to integrate that and have a platform that's really effective is going to be critical.
Hopefully you're getting me here. Can you still hear me?
Yep.
All right,
Yes.
great. Great.
Yep.
Technology is wonderful until it fails. But let's talk about your technology rather than ours. Talk to me about that Epic integration, what that means, and how that supports this.
Yeah. So, brick and mortar and human beings are two of the most essential components to being able to deliver healthcare. But what we're really, really excited about is the upcoming investment that we've made in a new electronic health record. So we've chosen Epic, which is really one of the two biggest electronic health records vendors in the country. And if you think about it, they're the gold standard. Of all the top 20 hospitals in the U.S. News and World Report, every single one of them is already on Epic. And so that's our process. We are starting in January, converting our whole system, and by mid next year, we will be completely on Epic. And the implications of this are just massive. So if you think about the way Orlando Health has grown over the years, we've been put together piecemeal by, acquiring Health Central here and bringing in physician associates over there, and now Jewett coming in. And every one of these acquisitions comes with its own independent electronic health record system. Now, we're fortunate that, in the year 2020, we can get these systems to kind of talk to each other so we can work, and share information back and forth, but it's still disparate, and there are still gaps, and there are still instances where there's waste. And so we think that this is just the next iteration of how we can become that much more clinically efficient by having a single system where everybody, any patient that goes anywhere in our system everybody will have the same access to the same information. And the power of that is just immense, because when an orthopedic surgeon looks at the record and can see what the cardiologist did, or the primary care physician can see what's going on, with an imaging study or with the results of a surgery, it's all contained in one environment. And beyond that, the bells and whistles, the capabilities of this thing to push out alerts, to highlight patients that are potentially of a rising risk nature because they didn't get a prescription filled or they went to the ED too many times in a short period of time. That creates, there are algorithms that create alerts and let various people know on the continuum that this is a patient who's sort of getting out of control and we need to do something about it. And so that's such a powerful tool to then now figure out how do we bring in a workers' comp program into that environment, because that'll enable us to make sure we're not doing multiple MRIs at different sites that don't talk to each other, or a patient, is having a physical therapy modality and we're seeing the results of that treatment. And then I would be remiss if I didn't point out too, Chris, real quick, just, there's a patient-facing element to Epic that is equally as exciting. So they have an app that you can use on your phone that's called MyChart. And it is so robust. You can get, a patient can have all of their information at their fingertips. But more importantly, if they travel, if they go out of state, they can actually share their entire medical record with a provider in another environment. There's an ability through this app to share your medical information. And the power of that, being able to avoid unnecessary care when you're away from home, or if you're in a crisis state somewhere and somebody needs to know what medication you're on, or what prior treatment you had for a certain thing, it's so powerful. So we're just thrilled to death. People can connect with their providers directly in there. They can pay their bills online. They can schedule appointments on there. So that is really the cherry on top of this effort.
So let me ask you one more thing with respect to that, because you start talking about data, and I know my team, and I'm sure some of the employers are really licking their chops here, because this is the one area that we've all struggled with. Getting access to real-time relevant data that tells the true picture. What kind of, HIPAA notwithstanding, right? We obviously don't want to violate privacy, but what are the implications, or what are the aspects that Epic can provide at an employer-facing reporting level that also, protects that patient privacy, but gives them real-time information? So the utilization, Michael, the most critical utilization would be, from our perspective, selfishly, having conversations about reserves. The reserve for this patient set at $500,000, but in reality, the system is telling us, no, it's probably closer to 220, given this and that aren't the other things, because the reserves are set based on the carrier's book of business, not specifically that patient or those results, right? So this is going to be a very powerful deep dive. Can you just talk for a minute about what the brief capabilities are from an employer-facing standpoint?
Yeah, so the structure that we're building out, there's a module within Epic that's called Healthy Planet, and it's their population health management tool. And once we go live, we are going to be the single largest user of Healthy Planet in the country. We will have 250,000 lives running through our Healthy Planet install, and that is a robust set of reporting tools, risk modeling capabilities, finding those rising risk patients and then addressing them actively in the moment is something that we'll have at our fingertips. So, part of what we're building out is at the traditional carrier level, the Blue, United, Cigna, Aetna. We're building out some interfaces and some reporting capabilities there that are going to serve those larger populations. And I think we need to find the right opportunities to create similar engagement with employers, because I think your point is well made that, this information is something we've never had at our fingertips, and then we just need to find the right use cases for it. And I think in a direct employer kind of engagement scenario, that's a valuable tool for us to justify, really basically aligning a population with us because of the things that we can do with that. So I don't have clear visibility into what those reports actually look like and to what extent we can share information. I'm sure we can filter out things to make it HIPAA compliant. All of that is obviously built into the technology infrastructure. I think it's just finding the right clients to engage with, understanding what their needs are, and then going back and developing those reports and producing them, and then sitting down and talking about them. Things that we're excited to do once we're ready.
Just knowing it's coming, Michael, it makes me feel great. So this is the selfish moment. And what I want to do is, because this is about an integrated model, right? So it's about, Jewett capabilities, Orlando Health's capabilities, what IOA can bring from a central focus and relationship from an employer standpoint. Karen, I'll ask you directly first. What is the value to you of a good, educated consultant broker when you're interfacing with an employer? How powerful is that? And what do you look for in those relationships?
I'm sorry, can you repeat the question again?
So happy to. So how important is it to have an educated consultant broker with respect to workers' compensation and navigating care patterns? How powerful is that when you find somebody at a very high level who supports that employer with respect to claims and just the whole operation?
Again, back to communication, it is extremely important. As you guys, I see you guys as the moderator of the whole thing. So for you guys to be knowledgeable as a broker, it helps the employer, and it helps the carrier and everybody in the mix to understand what's going on and facilitate. So facilitating and guiding, sometimes the employer may not have access to the right information, but they can turn to a broker that is knowledgeable and be able to get that information and help that facilitating that care for that patient. So it's extremely important to have a knowledgeable broker of knowing the key players, the reputable doctors, where to find the best care for that patient is crucial.
Yeah, thank you. I was hoping that would be the answer, but I wanted to be sure that's how you felt as well. So I'll turn it to you, Michael. And I think I do know your answer given our relationship and how we've worked together so far. But you realize the complexity of all of this, right? So it's very difficult, and you have employers that are unique, and then you have each employee is unique as well. So kind of the same question to you about.
Froze.
I think we're losing Chris midstream again. So
Back to
I
you,
think I know where you're going with that. Yeah, we'll run with what we heard. So my view of it is, having there, Chris, you're back.
Yes, I am.
Having having somebody who understands their employer's needs is so important. I think being able to translate those needs and express it to us as providers, and then have us be able to come back to the consultants who can then translate, for the employers. It's an important distinction. There's traditionally our relationships have been with those carriers, as I've mentioned before. And in that setting, there's efficiency in aggregation of lives across a broad relationship, like with a Florida Blue or a Cigna. But a lot gets lost in the middle there because you're just lumped in with everybody else, both from a provider standpoint and from an employer standpoint. So we're now talking about bridging these communication gaps and building these direct relationships and using the consultant as that conduit. And I think we can have much more meaningful conversations that are not, they're not diluted by the lowest common denominator. They're exacerbated by the attention to the specific needs of a client. And that's something that we've invested time and energy in building some infrastructure. We've got people on my team who are actively engaged in building these relationships with employers and with consultants. And the more of it we do, the more people will add to that framework, because I think it's important for us to continue to get closer and closer to the real purchasers of healthcare. We still value our relationships with the traditional carriers. We still need those for access to huge populations. But the work that we can do, the impact that we can make is micro. It's patient by patient. And the only way to really do that is to connect with people who can help us understand the actual needs and find that outcome.
And they see the world the way we envision it, right? I mean, I think that's really important, is that willing participants. This is a system in repair that takes time, so it's important to have all of that. It's interesting. We talk about this, right? So Jewett, Orlando Health, IOA, let's say Heritage Summit, employer. When you get the alignment through all of those, you no longer have 1 + 1 = 2. It really starts to be 1 + 1 = 4 or 5, because the exponent value of Karen's most important word today, which is communication, and fluent, smooth communication with access to transparency to data and discovering what that looks like, has a massive impact on cost of care, member experience, and most importantly, patient outcome. So we're excited about this whole conversation. We're excited to be already engaged with Orlando Health and now Jewett in a structured framework where we have the ability to access all of your providers directly through a network and do it on behalf of an employer. It is a work in progress for sure, but isn't healthcare overall. It's kind of exciting times. And I said it earlier, COVID has revealed weaknesses for sure, but it's also accelerated a lot of plans. And I know at IOA, this is our plan. Our plan is to continue to grow patient employee or doctor employee relationships and foster them deeper than they have been. Let's say the old is what has become new again. Back in the 70s, you had a relationship with your primary care. That was your quarterback. That has changed. And we're going back to that now because we recognize some degree going back to that is where the value really resides. And we can't do that without strong partners who are willing to fight through that and innovate with us and make some mistakes candidly along the way. But I think that this is a very powerful opportunity for not only employers, but employees, as well as all the stakeholders, because this needs to happen. I mean, at the end of the day, we've got to eliminate the disparate systems, unify the technology, give the employer and the patient, to your point earlier about Epic's capabilities, Michael, the information that they need, access to their own data in real time so that they can make better choices with respect to their care, where they go, how they access. And ultimately that will reduce cost of care, but it's absolutely going to improve the member experience. So I haven't seen any questions come into the Q&A box. And so I'm going to start to close this out just with some quick remarks. I mean, we're facing some really challenging times: COVID, racial tensions, murder hornets, and an election which is contentious to say the least. Really unknowns, but I firmly believe that healthcare is delivered locally, and we have to write our own narrative, not necessarily listen to the narrative that's being projected to us. And when we do that and we partner as a unit and we can support each other, the community is just much stronger. And so, excited about this partnership, excited about this relationship, and discovering what delivering healthcare will be and could be in the future is something that I can say Matt Williamson, Nicole Griever, Danny Anderson, Davis Anderson, my team that's on this call today is fully committed, invested in, and will continue to invest in it because we think it's a better direction. So I'm going to close out. I want to thank everybody for coming. Michael, Karen, thank you so much for your time. I know giving up an hour in these days is really substantial time given. We feel that it was important, and we feel your message is important to get out to the community. So we're very grateful for your time today. Grateful as well for all of our attendees. We are recording the webinar, as I said earlier when we started. We will be sending it out to all the participants. I hope there's a good information. I hope you take a few nuggets away from this and some aspiration as to where we're going and some inspiration, because I think that's what we're trying to deliver here. Thank you, everybody, for joining us. We're going to close out now. Appreciate you all, and enjoy your Friday and have a wonderful weekend. Thank you.